Hi, I'm Kate Marie from Slow Aging, and I'm here today with Dr Jarrod Meerkin from MeasureUp, and we're talking about muscle wastage, bone density and DEXA scanning. Thanks Jarrod for having us along.
No, it's great to have you here, Kate. Thank you.
As we age, we get this muscle wastage, otherwise known as sarcopenia. What can I do about it?
Sarcopenia is really, as you said, a result of the aging process. Unfortunately, as we age, the muscles get smaller in size, the muscle fibres shrink, and unless we do something to counteract that, it will continue until we start pushing up daisies. Sarcopenia is one of the easiest things to do something about, and it revolves around physical activity. Whether that physical activity is cardiovascular work, aerobics, or whether it's some other form of weight-bearing activity or weight training.
What is a DEXA scan?
A DEXA scan is a very low energy X-ray, and it divides the body into muscle tissue, fat tissue and bone tissue. So it looks at the soft tissue component, the fat and muscle, by dividing that according to the density of the tissue that it passes through. So as such, it gives you a nice 3-compartment model of body composition and accurately measures fat mass, lean mass and bone mass down to 1/10 of a gram. DEXA scanning fits in beautifully with the whole sarcopenia episode. It allows us to actually monitor and manage lean tissue mass. So we can scan individuals every year, every 6 months, every 3 months, and we can get over time a picture of where muscle mass sits within that individual. Is it decreasing? Is it increasing? Or is it being really nicely maintained as that individual ages?
When we do a DEXA scan, are there any ideal ratios or measurements?
There are some ideal measurements, and we've really built that up over the last 10 years, both from the research work I used to do and what we now accomplish here in the clinic. And look, most women, if they're sitting around the 35 to 45 kilos of lean tissue, they're doing really well. Most males, if they're around anywhere from 50 to 70 kilos of lean tissue, they're also doing very well. But what's more important than a group approach is actually examining the individual. And that's why we think it's so important to get your own scan and follow your own progress across the years. So a longitudinal approach to monitoring not only your fat mass but also your lean tissue mass. And I think the muscle side, the lean tissue side, is actually more important than the fat side in many instances, because it's the muscle tissue that prevents falls, allows you to maintain balance, allows you to pick up your grandkids and be active and do lots of different things well and truly into your 60s, 70s and hopefully 80s and 90s.
Why should I do a DEXA scan as I age? What are the benefits?
So we can actually say, wow, you've lost a kilo from each leg over the last 3 months. You know, what have you been doing? Why has that occurred? Or, wow, this is fantastic. That weight training program that you undertook, you actually have increased the muscle tissue in each leg by 2 kilos, and you've increased the muscle in your arms by 0.5 kilo in each arm. So it allows very specific information back to the individual. And that's the greatest benefit. It's like a cheat sheet for your body.
Are there any side effects or risks of DEXA scanning?
Well, with any radiological or procedure involving ionising radiation, we use the ALARA principle, which is, I've got to remember what that is, the lowest rate achievable, so as low as reasonably allowable, I think it is. So with that principle, we don't really like to see people for at least 3 or 4 months between scans. The radiation from a DEXA scan, I do have to say, is very, very low. If we put it into perspective, it's 1 to 4 microsieverts. You receive 10 microsieverts on a flight from Sydney to Melbourne. You receive the equivalent of a chest X-ray from Sydney to Los Angeles, which is about 40 to 50 microsieverts. So the DEXA is very, very low and very, very safe.
Could you talk to me a little bit about DEXA scanning for bone health?
Yeah, well, that's the DEXA's primary use, to examine bone health and bone density. So primarily the Australian government use an item code 12323 to allow every Australian a free bone density scan over the age of 70. So that is very useful in terms of screening for osteoporosis. And of the 50-odd thousand people we see a year, approximately 25% have osteoporosis, 25% have are normal, and 50% have osteopenia. So osteopenia and osteoporosis are very prevalent, and the DEXA is the tool that is used most to diagnose those chronic long-term diseases such as low bone density or osteopenia and osteoporosis.
Could you just explain to me about osteopenia, what that is?
Osteopenia, if for its official term, is just low bone density, but it is determined by looking at what's called the T-score of your bone density result. So from a statistical analysis, it's determined that if your bone density falls below -1.5, then you are considered to be osteopenic. For example, myself, I'm osteopenic. My bone density is low. And that is due to my genetic history or my familial history. So unfortunately, with all of us, you're essentially predetermined as to whether you're going to have osteopenia or osteoporosis. That's determined from both genetic and environmental factors. I've been able to maintain my bone density and bone mass over the past 6 years, and through physical activity and diet. So that's the environmental component, but it's the genetic component that we can't do anything about.
If you're doing DEXA scanning as part of a healthy ageing program, when would be the best time to test? I think getting to 70 is a little bit too late for that.
I think around the 60 to 65 years of age is ideal.
Isn't it a little bit too late to do something about your bone density?
Well, I think it's too late, not too late from an osteopenia perspective. It means that it might be the kickstart many require just to be more physically active, improve their diet, particularly if they've got no other chronic diseases like type 2 diabetes or heart disease. But if they tend to towards low bone density, then this may be the precursor to them getting started. Look, I think in an ideal world, women particularly, it might be at menopause. In men, we can push that another 10 years to perhaps around the 60, 65 years of age.
What's a healthy body composition? Are there any benchmarks or ratios that I need to look for?
A healthy body composition would involve a number of parameters. Let's look at bone first. Like any engineering concept, anything around 1 gram of bone per centimetre squared for the lumbar spine or the proximal femur, generally you're doing very well. For muscle mass, I like to see women with around, and also dependent upon their height as well, 35 to 45 kilos of lean tissue, and anywhere from 15 to 25 kilos of fat tissue. For males, similarly, bone density, 1 gram per centimetre squared, 50 to 65 to 70 kilos of lean tissue, and anywhere from 10 to 20 kilos of fat tissue. So from a body fat percentage then, let me put it this way. We deal with individuals here, and we don't like to use percentage. The reason why? Percentage is great if I want to compare my body fat percentage to yours, because we're taking fat mass and it's being normalised to weight. But I'm personally not interested in how I compare to others. I'm interested in how I do as an individual, in making sure that my health is as individualised as possible. So looking at the absolute values of fat mass and lean mass is what's ideal. So I, for myself, know that if my muscle mass decreases below 60 kilos, that I need to look at both my diet and my weight training regime to see if I can push that up a bit. Did my protein decrease a little bit too much over the past 3 months, or was my diet not great, or did I not perform any weight training? And that's what's happened recently for me, because I have a slap tear on my left shoulder and I haven't been able to lift weights for the last 5 months. So my lean tissue mass has decreased over that period of time. Now, unfortunately, at the same time, my fat mass has increased by 3 kilos. So I'm not interested in my percentage, I'm interested in the absolute values, because I know from myself an extra 3 kilos of fat tissue centrally for me is not healthy, or won't help my health any more than what it needs at the moment. So that's why the DEXA is really useful. So from an individualized perspective, you're getting a very good look at what's going on inside your body.
Well, thanks, Jarrod. That was really interesting.